Hello, my name is Amy. Thank you so much for participating in this QI initiative and promoting evidence-based guidelines to our patients. More often than not, breastfeeding and anesthesia are compatible. Breastfeeding is important to infant health, and receiving anesthesia should not interrupt someone's ability to breastfeed or the safety of their breast milk. In general, an individual can resume breastfeeding once they are awake, alert, and stable after anesthesia has been given. This chart illustrates that the relative infant dose for the majority of medications given in anesthesia is less than 10%, which is the threshold for safety. To highlight some of these meds, propofol has an RID of 0.1%, a single dose of IV fentanyl, which is considered safe, has an RID of 1%, and other medications such as sevoflurane and isoflurane are considered safe due to rapid elimination. On the next slide, I will discuss recommendations for pain control after surgery, but will first point out that the RID of most opioid medications range from 3 to 9%. Opioids can and should be used if needed for pain control. Pain control is important for breastfeeding patients, and the risk of low-dose opioids is low compared to the impact of poorly controlled pain on reducing breastfeeding success. Opioid-sparing techniques such as multimodal analgesia and regional anesthesia should be used when indicated. Infants should be monitored closely for signs of sedation. A maximum daily dose of 30 milligrams of oxycodone is recommended. Tylenol and ibuprofen are very safe and should be used first line. Tramadol and codeine should be avoided due to the rare risk of an ultra-metabolizer mother breastfeeding a slow metabolizer infant, resulting in neonatal overdose. Meperidine should be avoided due to reports of excessive sedation and difficulty breastfeeding in infants whose mothers received single doses. To end this presentation, I wanted to highlight two resources that were very useful: the ASA statement on resuming breastfeeding after anesthesia and the online database LactMed, which has detailed information about all the medications referenced. Thank you again for listening, and I hope that this is helpful.